Hi, welcome to Didactics Online. My name is Meighan O'Connor. I'm going to be describing and explaining just shortly and demonstrating the still technique. So, just a little bit about the physiology of it. The purpose of it is to improve range of motion and improve any fascial strain patterns that a dysfunction might have. So I'm going to be demonstrating on the hip, and while I demonstrate, I'll explain the reasoning for each step. So, can you lay on your back? So I diagnosed Rob as having a right posterior nominate. So the first step of still is that you need a monitoring hand. So I'm going to monitor at the SI joint. The next thing you need to do is have your operating hand bring the tissues in directly. So since he's posterior, I'm going to bring his leg up as if to rotate the pelvis posterior. The next step is to apply or exaggerate a little bit beyond the dysfunction. And then I'm going to apply compressive force. This compressive force will inhibit any muscles across the joint and any reflexes that might be putting in some nociceptive input to stop the joint from fully gaining back the range of motion. So I'm going to exaggerate, compress through the joint, and then I'm going to bring the joint directly while the entire time I'm maintaining pressure through the joint, and I'm going to bring his leg all the way off the table. So I'm anteriorly rotating that. So this is a gentle articulatory technique that you can use multiple times. You can use it on people that have osteoporosis even. The contraindications are really only if you suspect a fracture, and that's really it. The next thing I'm going to show is the first rib. So can you sit up? So I diagnosed his first left rib as being inhaled. So the concept is still the same. You just have to think of the muscular attachments and where you would put the compressive or distractive force. The distraction works sometimes just as well if you're using it through a joint dysfunction. Distraction on the capsule also inhibits the reflexes. So I'm going to use his arm as the tool, kind of, to increase the range of motion. And I'm also going to use his head because his scalenes are attached to the first rib. So since it is inhaled, his scalenes are contracted. So I'm going to start like this and put all of the tissues in their shortest possible place. So here, okay. So first I'm going to exaggerate everything. I'm going to put compression through his elbow, and I'm going to rotate everything around through the dysfunction. So this is both an indirect and a direct when you rotate, when you bring the tissues through the dysfunction. And you can do that a couple times because it's not very traumatic, it's just articulatory. And thank you for tuning into Didactics Online, and tune in for more. Thank you very much.